How's it going? Looks like you're stopped for a bit.
Yeah, yeah. Stopped in the Mission District, just running between all of the many things I have to do today.
Awesome. Well, thanks for taking the time.
Oh
So,
no, thank you so much. I really appreciate it. I'm
yeah.
stoked to be here.
Yeah, it's stoked for sure. Sounds like you've been up to some pretty cool stuff lately. What have you been up to?
Yeah. Well, I would say not getting fired from my day job, and on top of that, the fun stuff I would say as of late has been working on this AI tool to help people deal with health insurance denials. So it takes in denials and it generates appeals. And there's a bunch of magic in between, but
Hmm.
magic is what we're going to talk about.
Yeah. Let's walk through I mean, what was the I'm guessing this probably came from a place of personal frustration.
Oh yeah,
I mean, maybe
100%.
maybe walk us through what spawned this.
Yeah, so I think there's a few different pieces of personal frustration that sort of piled up over the years to cause this. There's like being trans in America and like dealing with health insurance as a trans person is really frustrating. Um, and then also seeing that impact a lot of my friends in the same community as I am. And so that's challenging. And then
What happens with
yeah,
trans?
sorry. So I
No
would say
worries.
things have changed a little bit over the past few years, but historically, most plans had essentially an exclusion for gender related care.
Oh,
And this has changed in the last, I want to say 6 years. Um, And so, you would go and you would find an employer who didn't have that exclusion and you try and get a job there. It's part of why you'll find so many trans people at the same company sometimes.
oh, interesting. I didn't know
It'll
that.
be like, oh, yeah, this place has okay medical care. And then everyone else is like, oh, fuck yeah. Sorry.
Oh, you didn't cuss on this.
Okay,
It's fine.
excellent. Okay. Oh, fuck yeah. We're all going to go work there because, like, I can survive. It's great. And like, so that's part of it. But even in those places where like so Google, for example, Apple, like would essentially not have that same language in the plan, but because it was so common, the health insurance companies were just used to saying no all of the time, and so even though it
Mm.
wasn't excluded in your plan or may have been explicitly covered, they would still say no, and you would have to go back and appeal and be like, no, 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 like actually that's bullshit. It is covered by this plan very specifically. It's on this page. You have to go read it. And they would like finally cover things. But like, you know, so that was a fair amount of frustration with that. And that would cover everything from just like, you know, drugs like hormone replacement therapy to like, more expensive things from the point of view of an insurance company, like surgery if you wanted to go that route. Frequently they deny those as well. Yeah.
Jeez, that's gonna be frustrating.
Yeah, yeah. But I would say like the plus side of like so like yeah, okay. It kind of sucks being like in this like group of people where health insurance plans are more likely to deny coverage for like the things you need to do to like continue to live. But on the other hand, you've got like other people around who will be like, yeah, 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 no, this is normal, not you.
Mm.
And a lot of like I would say helping each other like navigate the process was like something which I think sort of expected that, once you've gone through it yourself, you'll help the next person come up behind you, right?
Hmm.
Um, as an engineer, I'm lazy. And so if I can, instead of actually doing that, just write some software to do that, I can help so many more people and like I can sleep more. Although just like all software engineering projects, you started out to save yourself time and then quickly find yourself spending more time writing the software than you would have like helping the 6 people. But whatever.
So what's the software?
Yeah, so the software it's called Fight Health Insurance. It's not very creatively named. Software engineers are never accused for of being great at naming things. One of the two hard problems in computer science. Um, and yeah, and so that it's a mixture of things, right? It's got like a front end, which is like Python, Django, very bog standard sort of stuff. And then we've got like an LLM in there, which is all kinds of fun. And so, that's and it's a fine-tuned LLM specifically for health insurance denials
Interesting.
and appeals. And so I think it's really cool. And I really appreciate that there's open source LLMs available for people like me to do fine tuning on. I think this is really awesome. Um, and then, of course, because healthcare is intentionally stuck in the 90s, I would say, at the end, everything boils down to a pile of fax modems in my basement.
What? Wait,
So we've,
what?
yeah, so
Okay.
you can't submit an appeal electronically, right? Like you have to mail it or fax it to the insurance company. And so we've got like this like cutting edge 2024 large language model hooked up to a fax machine.
No way.
Yeah, it's I laugh because otherwise I'd cry.
Right. Yeah.
Sort of situation.
What the fuck?
Yeah, yeah, what the fuck indeed. That is our world. Our world is this
Oh
is
my
is one
God.
big what the fuck.
Yeah. Since this podcast is for nerds, techie nerds,
Yeah,
walk me through the fine tuning process for
totally.
yeah, that seems really interesting.
Yeah. So I would say like the first version we fine-tuned, or I shouldn't say we here being like me and like the three people that watch my Twitch live streams. Speaking of, if you're ever bored and you want to fall asleep, my Twitch
I've
live
actually
streams.
watched your Twitch live streams before.
Oh, thank you.
Yeah.
Okay.
Yeah.
So you may have actually seen some of this fine-tuning that happened.
I think you were debugging something in Spark.
Oh, yeah,
So it
that's
was
that's pretty common too.
yeah.
It's a lot of like debugging things in Spark or fine-tuning LLMs. It's pretty
Hmm.
great.
Yeah. Yeah, but good.
Uh,
It's good though.
yeah, yeah, thanks. So yeah, okay. So how it goes is like we'll start off with like our base model. And the first model here I think was Dolly was the model that I did a fine tune of. Um and relatedly it did not go well. But you start somewhere.
Yeah.
Um and so fine tuned a Dolly model and that was very much like you so Dolly shipped with like a sample fine-tuning guide, and it's like, okay, cool. I can kind of like modify this a little bit and just like throw it over the wall. The Dolly models were pretty small, and so you could fine-tune it on like if you had like maybe a few RTX 4090s or 3090s or something, you could fine-tune a Dolly model. Um, but it didn't give very good results, understandably. And so then there was like part two, which is like, okay, cool, we need to like make this work better. And so Mistral is like the
Mm,
next, not quite hotness, but like open source knockoff of hotness sort of
yeah.
thing that we've got. And so it's like, okay, cool, let's do that. But then I guess like the other thing is like I'm saying like we fine tune it, but like how do we get the data for fine tuning it,
Right,
right?
that's what I was gonna ask. Yeah.
Yeah.
Interesting.
So that's like an interesting problem because the people who have the data are the insurance companies, and they're not like incentivized to share it with you, right? Um, and so there's a few different approaches. One of them is you generate synthetic data, right? But obviously, if you just like have models generate random synthetic data, you're not going to produce a better model. You're just going to produce a different model. And so what I did is you find like this other piece of data, like you find something which can be turned into the kinds of inputs that you want. And so in this case, California independent medical review data is publicly available, and it's the result of insurance denials and insurance appeals,
Oh.
right? And they don't actually have the denial and appeal, but they have their final reasoning that they've made. And inside of that text is contained why something was originally denied and why that denial was or was not bullshit. Um, and so this is great because it's like it's pretty close to what we want. It's not quite what we want, but essentially we would use another model, so many models, to take that and turn it back into what could have been the inputs, right? And so like it's not perfect, but it lets you sort of get around this bootstrapping problem of how do I go from having no data to okay, I've got some data that's not quite in the format that I want to I've got some data that's in the format that I want. It's not perfect, but it's better than nothing, right? And so it is kind of weird as a solution to this problem, but it works. And I think it's a pretty cool technique, right? Like, you know, because we've got something that is the result of A and B, and we can ask some other model is like, well, what would A of B have been given C? And we actually get a pretty reasonable A and B out of it. And
Mhm.
that's enough to fine tune a model and let you start like producing solid appeals.
That's interesting. What does an appeal look like?
Yeah. So appeals are free text blobs, which is nice in that LLMs are pretty good at generating free text blobs. But generally, it'll have like a structure of like, dear insurance company. If I'm writing it, it's dear fuckers. Um, it doesn't always go well, but I'm normally pretty annoyed by the time like, you know, I'm talking to an insurance company.
Hmm.
Um, and then it'll start off with like the information about your claim. So thankfully, that information is generally in your denial letter itself. So the LLM can straight up just like copy that over. It's pretty easy for it to do. And then often it sort of depends on why you were denied. If it was medical necessity, you'll have a blob of text about like why this is actually medically necessary.
Mm,
Um, and incidentally, like that information, I would say, generally exists inside of the California data, right? Like
interesting.
they've got a lot of like, yeah, this is actually medically necessary for a patient who has X, blah 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 blah. And so the language model does a pretty good job of that. For contract denials, which is something that used to happen a lot for trans care and happens less nowadays, but still, it's important that you essentially feed in parts of the plan document because essentially you need to find the parts of the plan document that reference trans related care or reference whatever kind of care it is that they're saying like yeah, this may or may not be medically necessary, but it doesn't matter because we don't cover it. And so what you do is, you know, you have another model. We've got so many models here, but you've got another model that goes through the plan documents and is like, okay, these are the relevant pages. Do you want to reference them in your appeal? And so you'll reference those pages in the appeal.
Interesting. How long does
Yeah.
this usually take for you to generate an appeal?
Yeah. So I would say like from the point where we have like all of the information, it's like maybe a minute.
Dang.
Computers are fast.
Yeah.
Now, like collecting all that information, that takes a while.
Hmm.
And so there are things in there. So, for example, one of the things that we do is we query PubMed data.
Yeah.
Um, and how fast or slow that is largely depends on whether or not I've been rate limited by PubMed. So if no one's used the service in the past hour, we're really fast. Um, but if we've like say been in the news in the past hour, we're not quite so fast. We and like, but like it's still like it happens. Like I've got a loading screen that comes up with my dog on it to distract people. Um, it's got him standing next to a keyboard and says, "We're working hard on your appeal."
Oh,
Um,
that's cute.
yeah, it's pretty great. But you know, and so that can take a few minutes if things are busy.
That's interesting. And then, so an appeal is generated and it's sent fast,
Hmm.
I guess.
Yeah. So
So,
then the user can either mail it or they can have us fax it. We do charge for faxing, and that's because interfacing with the public phone network costs money.
yeah.
Um, but like they don't have to pay us. Like all of this is free,
Hmm.
except for the faxing.
Jeez. Or send it. Okay, then that goes to the insurance company.
Yeah.
And what happens next?
That's a great question. So, generally speaking, the insurance company then can pretty much ignore it for 29 days. and on the 29th day, send you back a letter. Normally, I would say a lot of prior auth denials that are appealed are the appeal is successful. So they'll write you back and be like, fine, we'll pay for it.
Oh, okay.
Uh, Sometimes though, they'll also write you back and be like, no, we still don't want to pay for it. Here's why. And then you can generate another appeal. And I think this is important for people to not get too frustrated if your first appeal gets rejected, because at your second appeal, you can ask for an independent medical review, and then it gets handed to someone who doesn't work for the insurance company to sort of adjudicate.
Oh,
And that's an important step because, like, I'm not saying the people working for the insurance company are always going to side with the insurance company, but their financial incentives are such that, like, it would be understandable should they do that.
yeah. But this third party on the second appeal doesn't work for the insurance company.
Yeah, normally they like work for the state or someone like who, anyways, they work for someone else.
Okay.
And that's actually, and that's the data set which, California publishes it. Washington State publishes their data set there. And, this is the point when, like, because it's also going outside of the insurance company, even if the person were working for them, like there's starting to be more records of what's going on.
Mm,
And the insurance company is perhaps slightly more incentivized to be like, "Ooh, I don't want to get caught with my hand in the cookie jar."
yeah, that's interesting. And then, so that's the second appeal. Are there more appeals after that?
It depends on your plan, but yes, there can be. Um, and this can go as far as like um, brain, sorry. Yeah, so for an ERISA regulated plan, you can actually take it to federal court.
Okay.
Yeah, I've never done that. I have threatened that before.
Okay.
I have been like, listen, the next step is I take this to court, and like, I'm happy to do that because I'm bored. But like,
Yeah.
and this is not legal advice, but like, looking at the things that I've read online, generally speaking, unless I was acting in a malicious fashion, I would not be responsible for your costs. And so, like, you're gonna have to pay a bunch of lawyers to show up in federal court, and I'm just gonna like walk in and be like, "Yo, doc, what's up?" And like, I might not win, but you're definitely gonna lose.
Yeah.
Um, and at that point, sometimes they're just like, "God damn it, please go away, you annoying person."
Yeah. Until the next one.
Yeah, until the
Like
next
the
one, and then
next
they're
time you show
like,
up.
"No, we don't want to pay for this." I'm like, "Do you remember me from like 3 weeks ago?" But whatever, it's fine. We're good.
I mean, you got to imagine these companies have teams of lawyers too. You can talk about a couple of them in a bit, but
They
it's
do. They do.
yeah.
But I would say that they're also like the other thing about that is you gotta, so for ERISA plans, so right, there's different kinds of health plans out there with different regulators. And a lot of Americans have what's called an ERISA plan, and that means that it's federally regulated and it's a self-pay plan. Another big batch of plans that people have are the Affordable Care Act plans, right, from the
Mm,
health exchanges. But if you work for like Starbucks, um, you know, Google, Amazon, GM, one of those big sort of like publicly traded companies. That's not a franchise model. If you work for like McDonald's, it's probably different. But like if you work for like a large non-franchise employer, very likely you have an ERISA plan. And in that case, the other thing that happens when you take them to court is you're effectively suing your employer, because your employer is actually the one who is the health insurance. At the end of the day, they're paying someone else to be mean to you, is how I like to think of it.
mm,
But that level of indirection goes away when you take them to court. And now, to be clear, like I have never sued my employer, but sometimes the optics of that can be something where an employer might be like, you know what, we would really prefer it if this problem went away quietly. So perhaps, dear insurance company, you could do what we want here and make it so that we don't like have a news story about how we're denying like hormones to our trans employees because like that would not uh, mesh well with our image of ourselves
hmm
in like San Francisco. Now, of course, like, work for, I don't know, Donald Trump media, they
Right.
might be more inclined to be like, nah, nah, fuck this shit. But,
Interesting.
yeah,
So, and you mentioned being in the news. I mean, what you're working on is, I'm looking at a few Google results here.
yeah,
When did you start getting attention on this project?
yeah. So I would say like attention probably started in August,
Cool.
with a wonderful SF Standard article. It was great. Had a really lovely conversation with her. Um, and that was fantastic. I would say that in the past 2 weeks, the national conversation has shifted.
Yes. Oh, maybe
Um,
remind the audience what happened.
yes, there was a CEO who was shot. And as a result, a lot of conversations around health insurance have sort of come to the forefront of the conversation in America.
Yep. Yeah, it has. Um, I mean, even I wasn't really aware of a lot of these denials. I think you probably put it on my radar actually with the project you're working on. But health, maybe it's just because of the virtue of, the health plan that me and my family are on. But we're pretty. It's pretty mundane stuff. There's nothing to really deny. A kid goes in for a checkup. Like that's pretty standard fare. That's preventative.
Yes,
But then you start looking at denials and I'm like, holy crap, I must live a very sheltered life, but this is quite evil stuff that's happening.
it is.
Um,
And it's
it's
impacting a lot of people, right? Like there's some studies out there about how for many, many Americans, like healthcare is it's in their top three costs, right?
yeah,
Like this is huge.
huge, huge. Yeah, I mean, and I talk to friends in other countries, and they're like, yeah, I have no idea what you guys have going there with your healthcare, but it's insane. So there's everything's covered there, but here it's like, something happens and you're not, especially if your claim's denied. I mean, this is something you might have to pay out of pocket, and I don't
Yeah.
think a lot of people can afford most things.
I mean, like looking at like when I got hit by a car in like 2019, right? Like I have I still have, I haven't been fired yet. We'll see what Monday brings, of course. Um, but like I had a good job at the time, but like I couldn't pay those bills,
Jeez.
right? Like I don't remember. I think it was under $1 million, but like it was like the kind of money where it's like, yeah, this is, I mean, those are real numbers, but like, no, it's not money that I've seen.
Hmm. Yeah, it's nuts. So with what happened with the United Healthcare CEO, like what attention
Yeah.
did that bring to your project?
So I will say it resulted in a lot more people talking about and thinking about health insurance and health insurance denials. And then I started to get a lot more emails from reporters,
Mm,
uh, being like, "Hey, do you want to talk about like health insurance denials and what people can do about them?" And
yeah.
it's like, yeah, sure, that's something I'm happy to talk about. Isn't quite the right word, but like I enjoy sharing that there are options out there.
Hmm. Yeah, that's interesting. And for the audience too, Holden and I were actually supposed to record this, I think, what, 2, 3 weeks ago. And then
Yeah,
United Healthcare happened. I was like, oh,
yeah,
interesting timing. This probably makes it a bit more pertinent to the public conversation right now versus a couple weeks ago.
yeah, yeah. I actually gave a talk the day before
Oh,
in
wow.
UC Davis, and thankfully they sent me a recording of it and were like, "Let us know if you want to edit anything out." And as a Canadian, there are some jokes that I will generally make about America that, like in retrospect, are now perhaps in poor taste, and I might ask them to edit out. Um, yeah,
Oh, boy.
yeah.
Yeah, well, I guess what's it like? Walk me through that, being Canadian and coming to America and seeing the differences in the healthcare systems.
It's really weird, right? Like it's like so like then to be clear, like the Canadian healthcare system is not perfect, right? Like there are people waiting for MRIs. It's difficult to get a primary care physician, right? Like there are a lot of challenges there. But like I think it's also really important to note that like, you know, the the question isn't like, do I have enough money to get my like bones fixed or like,
Right.
can I afford my drugs? Is a really that's not that's not things that people really talk about in the same way. I would say though that like also there are things that like I and like this is coming from a position of privilege, right? Like in America, if you are doing relatively well, right? Like there are things you can do here that you probably couldn't do in Canada, right? Or at least you would be waiting decades for.
Oh
Um,
well.
and so, it's a complicated trade-off, but I think that a system that leaves people bankrupt is probably not a good system.
Hmm. Yeah, it was
And
interesting. Oh, go on.
the other thing that I also want to like say is like this is maybe weird. So like in Canada, like yes, hospitals are struggling financially. That's normal. But like the other thing here is like a lot of American hospitals are also struggling, right? It's not like the
Hmm.
money is all going to doctors or even to like the pharma companies. Like the insurance companies are taking a a good chunk of the money, right? And like we're yeah, so it's confusing, I would say, right? Like to see a system where we pay so much and so little of the money seems to actually go to our care.
Right. Yeah, absolutely. I mean, Wall Street Journal had an interesting article the other day, where they were talking about how even physicians are just tired of dealing with insurance companies. They just it's insane. I know doctors who love their profession and they feel like the hands are tied because they don't feel like they can do the practice they want, right?
Yeah.
It's what does the insurance company want? Anecdotally, like, my dad lives in Asia. He got sick there with, what was it, pneumonia, hospitalized for several days. Had great health care, top notch. He said it was probably better than what he'd get here. Antibiotics, and all the other stuff he needed after staying in the hospital. The total bill was $80 US.
And that
$80.
that won't even cover walking in the door of an urgent care
No.
facility here,
Mm-mm.
right? Like,
No, it was Matt Housley. His mom, I think she busted her leg in Budapest last year, fell, right, and had to get an ambulance and get taken to the hospital and get that fixed. I think it was like maybe 100 or two US.
yeah.
It's just insane. Yeah. It's like,
And I mean, like, there are people here who like will not change jobs because they need insurance, right? Like, I
yeah,
myself have like looked at this project and been like, man, I really want to work on this, but also like, I need my insurance, right? Like, this is hard.
it's real hard. It's real hard. What's next for the project?
That's a great question. So, and I think this actually you inadvertently teed this up quite nicely. So one of the things that's happened is like a lot of people who are providers or work assisting providers have reached out and been like, I really, really want to use this professionally. And my answers so far have been like, oh God, no, 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 no. But now we actually have a sign up page and people are signing up for it. And so it's like, okay, yeah, there are a lot of providers that really, really hate insurance companies. And if we can automate some of the dealing with insurance companies for them, maybe we can make being a doctor more enjoyable again.
Mm,
That might be kind of a stretch goal, but like it's a stretch goal that I want to shoot for. And so that's what's next. Is like, yes, we should make this help the other people in our healthcare system fight back against the insurance companies as well, so that they can focus on providing,
yeah.
what we need instead of dealing with paperwork. Because
Yeah.
LLMs are great at paperwork, right? Like this is something that we're really, really good at. Like I think there's a lot of companies out there that are like, we're gonna make an LLM doctor. And I'm like, no, don't do that. I I would no, no. But like an LLM to fill out paperwork, oh hells yes. Sorry.
No,
I'm
that's what it's
biased.
good for. That's what it's good for. I mean, I'm having it write up a couple of sample agreements right now.
Yeah,
It's great at text generate. It does it. Otherwise, I have to sit there, I have to get a lawyer, all this other fun stuff, and that's, LLM does about. Actually, my lawyer's going to use ChatGPT too. So
yeah,
done, done. Yeah, that's interesting. I didn't realize the provider angle.
yeah.
But yeah, I guess when you understand the angst that all these people have to go through to deal with insurance companies, I guess that's a pretty big market too. It's a
It
pretty big
is.
market.
It is. And in fact, if anyone happens to work at a venture capital firm, this is not a solicitation to sell or buy securities. But I'm not too hard to find.
Yeah, that's awesome. Yeah, like I said, yeah, big fan, and tragically, is I think as tragic as what happened to the healthcare CEO, United Health CEO was, I think that drawing attention to this conversation is it's necessary because I mean, even Warren Buffett, I think he had a really good saying, where medical costs are sort of the tapeworm on America's economy
Yeah.
right now. If this isn't fixed, you know, it ain't good. So
No, if we don't fix how much money we're spending on even just like healthcare administration, right?
yeah,
Like not like how much money we're spending on CT scans. That's probably fine. I don't think anyone else out there is like, oh man, I really want to go get another CT scan. But like the amount of money we spend on having an administrator at the hospital argue with an administrator at the insurance company, like that's
hmm
we're just flushing money down the toilet,
oh yeah,
lighting it on fire, whatever analogy you want.
yeah. Well, and it gets passed on to you and your employer at the end of the day too, which
Right,
sucks.
right. And like yeah, so like we see it both in increasing healthcare premiums, but also in this increasing denials, right? Like
Hmm.
we're paying more for less. It's really annoying.
Yeah,
It's like the shittiest version of shrinkflation.
it totally is. Yeah, I mean, every time I have to go to the clinic, I'm just like, I have, yeah. The problem is you don't have any idea how much it's going to cost up
Nope.
front. And you look at your bill and you're like, I don't even know how the hell you came up with this number for whatever this is that you just did. It's
Yep.
insane. It's,
Yep.
but I've never had a denial. So again, like for me,
Thank
it's kind
God.
of like out of sight, out of mind. Because I was like, people get denied for stuff, and that's oh yeah, I guess that would make sense. That would happen if you're trying to cut costs.
Yeah.
But it's nuts. It's
No,
nuts.
it is. And I mean, to be fair, like they generally don't deny like a lot of routine basic care, right? Because
Yeah,
like they know that that's a bridge too far. But like, yeah, yeah. If things start to go badly, which is what insurance is supposed to be for. Ugh,
yeah,
yeah. Sorry, I'm
no, yes.
very biased.
No, no, you started a whole project about it because you wanted to fix it. So I think that's awesome.
Yeah,
Um, cool. Anything else you want to cover on this?
yeah. I mean, so I think, and this is mostly just because like this is a bunch of other nerds all listening here. I
Yeah.
think that like for all of us out there who are building, you know, cool nerd things, that's awesome, and we should still keep doing it because like that's amazing, and it's how we build new cool shit. But like, take some time and ask yourself like, is there a social problem that I care about trying to solve that I could solve with my cool nerd thing?
Hmm.
And if so, like, give it a shot. Like, it's you might be able to, and if not, that's okay too, right? Like,
Yep.
it's going to take a lot of people trying to make the world suck less to actually make the world suck less.
Yeah.
Um,
Absolutely.
and yeah, um, I guess the other tiny last little bit is just big love to all of the Python community for yeah, um, just all of the data science tools and also just being so welcoming.
Hmm.
So yeah.
Yeah. And you wrote it in Django, right? So
Yeah, yeah. Not yeah, so we use Python for so much of this. Part of that is because like obviously like uh I know I know many programming languages, but like I know Scala and Python really well. And it's like, well, of those two, if I want to work with a bunch of other people,
yeah.
Python's probably the language where I'm going to find a lot of other people to work with.
A lot of other people. I mean, it's the most popular language in the world at this point,
It is.
and even Django. I'm an old school Django dev, and it works really well. It's probably something I would use maybe for a
It
new app if I wanted
does.
to.
It works super well. And like it's I don't know. I mean, it's not perfect. Nothing is, but like it does really good trade-off between magic and explicit in my
Hmm.
mind.
Yeah,
Because like I've written Ruby apps and I'm just like, I have no idea what's happening here. Like it's working, but like I'm convinced if I blow on this the wrong way, everything's gonna catch on fire.
it might. It might.
Yeah, yeah, yeah.
That's cool. I'll put a link in the show notes to your project as well. But yeah, happy to help anytime. I think you're doing a good thing. And I like what you said about nerds, I think finding ways to help, solve big problems. There's no shortage of big problems. For me, that's education. I feel like that's something
Yeah,
because I have kids, it's like that's something I've been really focused on and just care a lot about. For others, it might be something else, but there's no shortage of problems to solve out there. It's cool you're
your
doing that.
education stuff is amazing. And like, yeah, like, and it doesn't have to be weird, complicated AI stuff, right?
No.
Like text message reminders to people that their EBT card benefits are going to expire if they don't do
Mm,
something. That has a huge impact on people, right? Like
yeah.
all kinds of things out there. Anyways, sorry,
Yeah.
sorry
No,
for
it's good.
interrupt.
Yeah, no, it's cool. Well, I know you got to get going to your next appointment here. We're
Yeah,
just actually recording this while Holden's literally parked, so let you get to it. But yeah, great to see you again, and hope to
yeah,
see you. I
good to
guess
see you.
maybe if you're going to be at day to day
Yep.
next month, I'll see you there. So we'll go
Oh, heck yeah. Cool. I'll see you in January.
we'll get a beer. Yep. Okay.
Yeah, yeah.
All right.
Thank you so much. And thank you for
Anytime.
all your help. I
Most
really,
welcome. Yeah.
you're awesome.
Yeah. Thank you. You
Yeah,
too. Thanks.
heck yeah. Okay, cool.